stepping up the fight against COVID.
From today, people will be able to get their 4th booster shot.
Case numbers are going to continue to climb, which is why we're acting so quickly, expanding access to antiviral medicines.
Around 4,000 people in hospital, 300 deaths each week. The highly transmissible new Omicron subvariant, BA4 and BA5, taking hold.
We can expect a doubling of all of our numbers within a month.
But as the COVID winter wave strikes, health experts are fearful the government is sticking its head in the sand.
We've been quite blasé about COVID of late, and because we're blasé about it, people think it's not an issue, and of course it is an issue, and that's just getting worse.
The election gave us a false sense of security, and unfortunately, to some degree, we've been like frogs boiled slowly.
The health department has to understand that the job is to look after the people of the country and not just save money.
They won't return to things like the pandemic payments. They've cut back on telehealth to actually help GPs actually prescribe these antivirals. The only thing people are hearing is we won't do mask mandates again.
Federal and state governments reluctant to reintroduce wider mask rules.
Well, the Chief Health Officers didn't recommend a broad-based mask mandate. I think deep into the 3rd year we've moved beyond those community-wide mandates.
I think common sense ought to prevail here. The government obviously is keen to ensure that the economy recovers strongly from the pandemic.
And despite chief health officers urging employers to consider imposing working from home rules, major business groups say they just can't go back. Employers already bracing for a month of record sick leave as the new variants take hold.
Those hospitality businesses, those travel businesses that have been severely hit during the last 2 and a bit years would probably find themselves almost at the wall. It would be an absolute devastating blow, particularly for CBD, trying to cope with a change in people movement.
So as this Omicron wave begins to bite, have we got the balance right?
Well, Tim Piper is the Victorian head of the Australian Industry Group, and he joins us now to talk through this. Tim, federal and state chief health officers are recommending businesses encourage some employees to work from home. If that's the advice, should it be implemented?
Well, I think Australians and especially Victorians are sick of being told what to do. And what we're finding is that people really don't want to be going back, being forced to go back to work or to stay home. They want to be able to make their own decisions. And I think that's what we should be able to do here. People should be responsible for what they're doing. They should be looking after themselves. They should be taking measures for themselves and for other people about how they can look after themselves without being forced to stay home. I think the idea of just returning back to a situation where you are required to be at home is really a backward step for business and for confidence, especially for Victorians. I mean, Victorians had over 200 days where we were literally locked down, and it's not a good message to be giving.
Tim, I get your point on mandates, but I think what this government committee was saying is, look, we have a problem in the country where staff are off sick increasingly with COVID. Businesses are having trouble trying to get numbers to keep the business running. Might it not be a good idea to start to think about whether you might urge some of your workers to stay home and work?
Well, at the moment, we've got that option, and companies are doing that where they need to. But the point is, what we're finding is that people are just not as efficient at home. They need to be coming into the office. We've got a hybrid arrangement just about everywhere. Everybody's got the chance to be coming in 2-3 days a week, sometimes less, sometimes more. The situation we've got at the moment is pretty flexible. And I think whatever you put there is going to be seen as a mandate. And I don't think people will want to have that. They don't want to be told what to do anymore. Let's make it flexible. Don't be forcing people to stay at home. They don't want to do that anymore.
One of the things that the Australian economy has really benefited from throughout this pandemic is the fact that the health policy is sort of dovetailed with what business wants and needs. And I'm just wondering why at this juncture you're saying we're not really going to listen to the health advice any longer.
We're continuing to listen to the health advice, and we have to do that. But at the moment, the health advice is quite varied. Some are saying this, others are saying this, it's not necessary to be literally putting in another mandate. We really need to be listening to what's good for the economy and good for health. That's what we should have been throughout this pandemic.
With respect, are you across what the AHPPC recommended?
I'm across what the AHPP recommended, but I'm also listening to other medical practitioners who are suggesting that we don't have to be making these mandates at the moment, that we don't have to be requiring people to be staying at home. I don't think that's the right message at the moment.
This is not Trump's United States where you choose your own adventure and which doctor you listen to. Australia's done pretty
It's
well
not.
by
We're
listening to the
far from
AHPPC. So which are the doctors you're listening to that are giving you this advice?
We're far from that, but if you listen to the doctors who are giving the advice at the moment, it's quite varied. Some are suggesting that we aren't nearly in the situation where we need to be suggesting mandates again at the moment.
Tim, let's get specific. Who are the doctors that are telling you different advice?
If you were listening to Peter Cahoon, who is an epidemiologist of some ilk, he was suggesting today we aren't where we were back in January, and it was back in January that we had these mandates. Reintroducing them now is only going to affect people's confidence, and I think you'll find that people refuse to do it anyway. People in Victoria are sick of being told what they have to do.
All right, good to chat through it, Tim. Thanks for your time.
Thanks very much, guys.
It's actually Peter Collion, but I mean, OK.
I think he's got a point, though, right? In formulating public health policy throughout this pandemic, the authorities have had to judge what will the public accept. And I think it is different now to what it was 6 months ago, 12 months ago, 2 years ago. I think there is fatigue. I think
that would be triggering, hearing work from home orders, mandates, all that. For a lot of people, I think people that even want a safe community, safe workplaces, who, care about making sure those around them, I think hearing that, there's not an appetite for it at all.
Except that. But if you talk to anyone who's in a hospital that are now being overrun in every state of the country by people with COVID, they have to stop the numbers continuing to grow. The numbers in intensive care are going up. We're in the middle of winter. It's getting worse.
Conversations can happen between employers and employees, can't they? Conversations rather than get back to mandates.
Let's be frank what's happening here. The politicians are not listening to the health advice anymore because in Victoria and in New South Wales they've got elections coming up and they don't want to tell people that they have to get locked down.
Do you think, though, the public would accept another forced work from home period or a forced mask mandate?
If you're laying in the back of an ambulance for 8 hours on a ramp because you can't get into hospital to a bed because it's full of COVID patients, yes.
But that's the individual. I'm asking the community at large. Do you think the public would accept it?
Yes. I think we're on the edge of the public saying, OK, we need to introduce masks at certain places more frequently. Peter wears a mask regularly in places, don't you?
I wear
Personal choice.
On public transport, the shops, I wear a mask. I'd much rather be doing that than thinking of going into another lockdown or anything like that. So I think masks, it's personal choice, obviously, but masks don't freak me out like they do a lot of people. And there's different kinds of masks, and the ones that are a bit, heavier, a bit harder to wear.
It was so interesting, and I'm not going to talk about travelling all the time, but it was so interesting travelling how different every single place was with who wore masks, who didn't wear masks, which places were treating it seriously, which weren't. It was just so varied. The whole response was varied.